On March 13th, President Trump declared the coronavirus a national emergency. With that designation comes the offer of up to $50 billion in support for states and localities. This comes from both FEMA and the disaster relief funds that are available. This is also on top of some coronavirus funding support that came in prior weeks to the tune of $8.3 billion in emergency spending. The declaration itself is what we're talking about today. This means the feds can use the Stafford Act. This is a law that governs disaster relief efforts. It's technically called, and here's the long title, the Robert T. Stafford Disaster Relief and Emergency Assistance Act of 1988. It authorizes the delivery of federal technical, financial, logistical, and other assistance to states and localities. And this only can happen when it's a declared major disaster or a declared national emergency, and that's what we have here. So in short, it just means the feds can provide emergency funding to states and local governments. Congress can do more. Congress can actually authorize additional funds as events dictate. And right now we see legislation sitting in front of the House, a coronavirus response bill in the works that would provide additional support for things like free testing, paid family leave, funding support for food stamp and food share benefits, expanded unemployment, and expanded Medicaid. But that's not part of this national declaration. Let's talk a little bit more about what the Stafford Act could do. It can authorize the grant of authority of the U.S. Department of Health and Human Services to waive or modify certain parts of Medicare, Medicaid, the Children's Health Insurance Program, and even HIPAA. This is authority that is granted through Section 1135 of the Social Security Act. We've talked about waivers before, but it's almost always been Medicaid waivers that are Section 1115 waivers. This is Section 1135 waivers. This says if a public health emergency and a national emergency have been declared, there is more authority given to Health and Human Services to make changes. Now, we have both of those right now, which means HHS, Alex Azar, the health secretary, can start making some Medicaid and Medicare changes that could make getting some services a little easier. It could do things like help provide emergency medical care and temporary medical facilities, supply food, water, medicine, supplies. It can change management control and reduction of immediate threats to public health and safety. People, in short, are hoping this declaration could mean some flexibility for HHS to produce more tests, more testing sites, and to make it a little bit easier, especially for vulnerable populations, to get services. But there are still some gaps. What's not part of the declaration is an expansion of Medicaid. That's what the House bill was hoping to do, but that's not part of what this is doing today. So some people are saying, you know, the waivers that are envisioned for the Medicaid program are more along the lines of licensing requirements and how long you can stay in a facility or how many beds can be reimbursed. It has nothing to do with the patient-centered reimbursement for care. So what's still not clear at the end of the day, and we will keep coming to you with updates, is that coverage piece. What is the cost of testing? What is the patient responsibility? As a part of that cost, what is the cost of treatment, and what would the patient responsibility be for part of that treatment? Like we said, this is changing quite dynamically every day. This was today's national emergency declaration. As more changes will continue to come to you, so be sure to subscribe to stay in touch.